This presentation describes what hemorrhoids are, the typical symptoms they cause, and how they are best treated. Under normal circumstances, we have 3 anal cushions, and these are normal structures that you are born with, situated about 4 centimeters in from the outside. They are simple elevations of the lining, and they have a very important function, and that is when they are opposed at rest, they help to provide a seal so that nothing leaks out, aided by the sphincter muscle. This is a diagrammatic representation of a longitudinal section through the rectum and the anal canal. In this diagram, the anal cushions are represented by the label internal haemorrhoidal plexus. This is the point at which all hemorrhoids originate. For reasons that are not clear, the cushions increase in size and start to cause symptoms, at which point they are known as hemorrhoids or piles. The best definition, therefore, of a hemorrhoid is a symptomatic anal cushion. We are never quite sure what causes hemorrhoids. However, chronic constipation, straining at stool, a diet that is low in fiber, and pregnancy exacerbate them but do not cause them per se. The problems that women experience with hemorrhoids during pregnancy tend to disappear once the pregnancy is over. There is absolutely nothing to support the notion that reading the newspaper whilst on the toilet or sitting on cold floors causes them. Hemorrhoids are categorized or staged depending on the degree of prolapse, and this largely dictates the management. Prolapse is when the hemorrhoids become significant in size and they tend to lose their internal support and move downwards, and they therefore have an external component. Stage 1 hemorrhoids are ones that do not prolapse. Stage 2 hemorrhoids prolapse but then reduce spontaneously after defecation. Stage 3 hemorrhoids are ones that prolapse with defecation but then require manual reduction, that is, they need to be pushed back in. And stage 4 hemorrhoids are ones that are permanently prolapsed and will not reduce. This is a diagrammatic representation of the 4 stages, and in this diagram they are called degrees of prolapse rather than stage. Just to recap, first degree do not prolapse, second degree prolapse but reduce spontaneously, third degree prolapse requires a manual reduction, and fourth degree hemorrhoids cannot be reduced. As far as symptoms are concerned, patients typically describe discomfort, bleeding and itching, otherwise known as pruritus. The pruritus is a manifestation of a couple of things. Firstly, a failure of the seal leading to fecal soiling, but also the hemorrhoids themselves produce mucus, which is intensely irritant to the skin around the anus. And as previously discussed, the anal cushions lose their supporting structure and migrate downwards, otherwise known as prolapse. The treatment of hemorrhoids is very much dependent upon the stage. Stage 1 hemorrhoids can generally be treated conservatively in the form of making sure that there is plenty of fiber in the form of fruit and vegetables, together with a daily dose of bran, and if needs be, a fiber supplement such as psyllium husk. If having done this, the patient continues to experience symptoms, then a procedure is indicated. Similarly, for any degree of prolapse, a procedure is indicated. There are a number of procedures that can be done for hemorrhoids, but my preferred treatment, having done all of them over the years, is now the haemorrhoidal artery ligation and recto-anal repair procedure, otherwise known as the HAL-RAR. Rubber band ligation is ineffective, with most patients returning saying, "Doc, you haven't fixed them." Conversely, a hemorrhoidectomy, whereby the hemorrhoids are simply cut out, is very inadvisable on the basis that it is unscientific. It removes partially or wholly the anal cushions, which, as we discussed already, are 3 very important structures, and thirdly, it takes patients several weeks to recover from this operation. The haemorrhoidal artery ligation and recto-anal repair procedure is a very effective way of dealing with problematic stage 1 hemorrhoids and any hemorrhoids that have a degree of prolapse, namely stages 2 to 4. It is done as a day case under general anesthesia. The patient requires an enema preparation only. The principle is to identify the blood supply of the hemorrhoids, These are the haemorrhoidal arteries, using a special Doppler ultrasound probe and then to ligate the arteries. This then stops the inflow and reduces the pressure effectively to 0. There are usually somewhere between 6 and 9 arteries to find and ligate. The second part of the procedure is to plicate the prolapse, thus reducing it back into the anal canal. Post-operatively, patients experience mild to moderate discomfort, but this is usually well controlled with medium-strength painkillers such as endone. There is usually a return to normal activities within a week to 10 days. Patients, however, need to be a bit patient with regards to the long-term effect because it takes about 12 weeks to achieve the desired effect. For further information about this procedure, please see the relevant section of the website, which includes a procedure video.